Hi friends, this is Rebecca of Born in Ecstasy Birthing. Let's talk about optimizing your situation in the case where you need a C-section. Now, sometimes we don't really have a choice and we know we are going to need one ahead of time. And so there are a few things that you can do in preparation to make it more easeful and more comfortable for yourself. One is really strengthening your whole pelvic floor and your abdominal muscles, the transverse abdominal muscles especially. This is helpful whether you're going to have a C-section or not, but really squats can be super great. Make sure you have your back nice and straight and you have tall posture and are engaging your glutes, okay? And if you're doing any sort of PC muscle squeezes or Kegels, make sure to really relax in between. Like often it's inhaling, squeezing up and in, and then exhaling, really deeply relaxing, okay? Make sure your spine is tall again and your back straight for that type of work. If you are planning to get a C-section, learning about it ahead of time is really valuable, like the process and the steps of it, what is entailed in the spinal, whether you want a clear drape or not to be able to see, and asking for, like, setting it up, for example, like with skin to skin right afterwards as much as possible. You might want to do vaginal seeding, which really is so wonderful for their biome and has been shown to really help have less allergies and that sort of thing. So something to learn about for sure, and ask your providers if they would be willing to do that, or even do it yourself. You can learn about that. Please message me if you want to learn more. But there are things you can do, like bringing a nice warm blanket in. They won't let you have it during the operation, but afterwards and beforehand can be so wonderful to have a blanket that smells like home and to really be warm enough and so comfortable in a blanket that you especially love, and have your baby in there as well. Robes too, really great robes and slippers can make a big difference. Make a playlist ahead of time, okay? Have some nice, relaxing, soothing music and ask your team to put it on during the C-section so that you can focus and relax. Even using hypnosis can be a wonderful way to have your mind be present and relaxed and more in the celebration and the enjoyment of the time that you get to meet your baby versus scared and stressed out. All right, so your experience matters and you want that birth to be lovely for yourself. So consider some things like that that make it really enjoyable, okay? For some things you can have afterwards, nearby, both at home and at the hospital, are like heating pads that are awesome and soft, and ice packs that are squishy, like the gel packs. Even like you want 2 of those. And in the hospital, they will help you with ice, but often the gel packs are a little nicer. I wouldn't necessarily take them to the hospital, but I would have them at home. And it's important to establish consistency with your pain meds. Do not try to skimp and take less. Otherwise, you will get off of, you'll go into more pain than is necessary. And once you get into that pain cycle, it is really hard to bunk it. So really stay on time, set timers on your phone, and make sure there isn't any lapse with getting the prescription or anything like that. There are also herbs and tinctures like After Ease that you can get, or motherwort, cramp bark. There are things that can help you have manage the cramping that can come after birth or a C-section. This is especially true if it's not your first baby. And your subsequent babies, it's often really surprising how much the after pains hurt. So using your hypnosis to breathe into them, if you've learned hypnosis or some relaxation techniques, can be helpful. Know that they'll come when you initiate lactation. So you can take the cramp bark or tincture ahead of time, right before you nurse, so that it does help when those cramps start up. And another one to remember is to really, you can gently hold a pillow to your incision if you're laughing or coughing, because it really hurts at first, and you want to kind of support the integrity of that incision to not pull apart. So really giving that support can be wonderful. Having a brace that you put on after in the subsequent days can be really helpful as well. Loose fitting clothes, really loose fitting pants are highly important. Granny underwear, or the underwear that you get from the hospital that are super loose, can be really so nice to wear at first, and then you don't worry about staining them or whatever. You just kind of know that that's what you're wearing for a little bit. You will still bleed. The bleeding will be most the first week, and then over the next few weeks taper off. But having some really good heavy pads or Depends can make it nicer. Raising your toilet seat with one of those toilet seat raisers makes a huge difference, because you'll be going there a lot, and it is painful to sit down and then get back up again. So having it higher really helps. So it's worth the small investment with that. Let's see. I think I hit the main points. Really plan on staying in bed at least for the first 2 weeks. You will not feel like moving a lot. So set up stations so that everything can be in reach around your bed. And so books, nice drinks, beautiful snacks. Make sure you have meals planned and enough support around meal planning so that you are getting plenty. You will be hungry when you're nursing or breastfeeding, and you know, it's important to train the folks that are helping you and have enough help around you that you're constantly getting the good foods and drinks that will help you recover best. And then, yes, if your partner does plan on going back to work, make sure you get another full-time helper when they're not around for the first few weeks. You will really want that. You cannot lift things. It's not great to be up very much at all, even during the second week. So really getting enough help is extremely important. Hire a postpartum doula, get a family member to fly in or come visit you, enroll a schedule with friends. Really lean on your team and the loved ones around you to help you, because you will want that help. And if you do all of these things, it will go easier, and you just know that it is challenging, and you will recover and start feeling like yourself over the next few weeks. And good. So thank you for watching. I wish you the very best recovery, and many congratulations on your upcoming baby. And thank you so much. Bye-bye.